Erica Dwabushalila is packing medical supplies into a kit bag, as she does every day of the week. She is not a doctor or a nurse, but she must make sure that she has all she needs for the day ahead. A thermometer, a scale for weighing babies, bandages, measuring devices, antiseptic solution, painkillers, record books. Her homestead is on the edge of her village, far from the nearest clinic. It is early in the morning as she sets off, but already the sun is fierce. Today, Namibia's Zambezi region will be gripped by sweltering heat. She is holding a health promotion session in her own village, demonstrating correct condom use to a group of young men. Then she must get to another village, one of the 4 in which she works. It is many kilometers away, but people are depending on her, and she must see them all. Erica is a part of a new wave of healthcare services spreading through Namibia's remote rural areas. In the past, village communities who needed medical attention first had to undertake an arduous journey to the nearest clinic or hospital, perhaps 50 or more kilometers away. But today, basic healthcare is becoming available in the villages themselves. This is the story of the Namibian government's Health Extension Workers Program, being supported by the World Health Organization, the European Union, and other partners. Namibia is a country in transition. Profoundly traditional, particularly in remote rural areas, yet embracing modernity and change, it must still struggle to overcome the deep-rooted disparities that exist between financially empowered communities, mainly in urban centers, and rural communities who must struggle to obtain life's basic necessities. For these rural communities, healthcare has long been available, if they are able to undertake a long journey to the nearest clinic or hospital, followed by a lengthy wait there before being attended to. All too often, the barriers between the people and healthcare services have proved to be insurmountable. The upshot has been that some rural community members with serious but treatable conditions have not been able to access treatment, that some pregnant women have not received antenatal care, and some young babies have not had their development monitored, that localized outbreaks of diseases have remained hidden until they have spread more widely, and that important public health messages have not been adequately heard. Namibia is not the only country that has had to face the challenges posed by rural isolation and relative poverty. Like other sub-Saharan African countries, Ethiopia's community-based health extension program is bringing health services closer to the people. Ethiopia's program commenced in 2003, and by 2010, over 34,000 health extension workers had been trained and deployed throughout rural communities. Namibia's Ministry of Health and Social Services visited Ethiopia to learn from this very successful program. And in 2012, the first health extension workers were trained and deployed in Namibia.
To mention that we consider community health workers an important part or important component of our health care service delivery, especially in the remote areas of Namibia where it's difficult to reach. Also for the fact that we want to draw the community health workers from the community, known by the community and culturally linked to the community. So we draw them from the community, we train them, and then we deploy them back in the community. We're not piloting this. It's something that has been done in the world successfully, and I think the Alma Ata Conference Declaration of '78 was literally looking at this as a way of addressing issues of public health. So we're not reinventing the wheel. We're just perhaps modifying here and there. For instance, on the issue of communication, we want to consider deployment of new technological methods of communication, whether mobile devices, as we know that Namibia has got It's actually one of the countries on the continent with highest cellular telephone penetration. Almost every household in the village has got a mobile device. So we want to take advantage of that.
The training equips the health workers to respond to immediate community needs on site, without community members having to undertake lengthy and potentially hazardous trips to the nearest clinic. They are taught to provide basic first aid, counseling on diseases such as malaria, TB, HIV/AIDS, and non-communicable diseases like diabetes and hypertension, and first-level newborn and maternal care.
We, in essence, have been on the health extension work now for the last 3 years, and the intention is that we have a program that will cover the whole country. The individual health extension worker will be covering about 100 households. That averages on about 500 people per health extension worker. What we've already seen is that communities have taken on the health extension workers very enthusiastically. They're making a great impact in terms of household hygiene, one of the important areas. They should engage with pregnant mothers, with young women. They should engage with all the children under 5 years old, make sure that they all get immunized. And one of the important areas is nutrition, that we see as soon as there's malnutrition in the community, in the household, then we will have the health extension worker pick up those cases, report them to the clinic, and the clinic can then bring in the necessary interventions, medical, health care, whatever is necessary.
The health extension worker training is conducted in English, and to qualify for selection as trainees, candidates must have achieved defined English grades at school. With European Union funding, the World Health Organization currently supports the 6-month cycles and field monitoring in 3 of Namibia's regions. It is essential that after health extension workers have been deployed, they are not left in the field without support. They all attend monthly feedback meetings with hospital personnel, at which they share their experiences of the last month, iron out any problems that may have arisen, and receive refresher training as required. All extension workers must set their own targets for client screenings and health promotion for the month ahead, and these are assessed and adapted as required.
In addition to that, every health extension worker once a month comes to the clinic, and there's a meeting with the clinic staff where all the health extension workers from that catchment area come together, and they actually have written reports which they then submit, indicating the number of vaccinations, indicating the number of engagements in terms of counseling, etc., that they have done with the communities.
Village health committees play an important role in recommending candidates for the training and in liaising with them once they return to serve their own communities. Iruka Rushani is a member of the Village Health Committee. She explains that the role of the committee is to work closely with the extension health worker in the village. For example, they will immediately inform him if a woman is pregnant, or a baby, or any community member is suffering from a health problem, or is in need of counselling. The committee is elected by the village community, with representation for the traditional authority. Iruka believes that the village community supports the health extension workers program because it has made a real difference in their lives. The health extension workers program ensures that no matter where their villages are situated, community members benefit from the same services delivered by extension workers following identical protocols. Wherever they are based, extension workers begin the day by packing and checking the contents of their bags before heading out in service of their communities.
Actually, I was a volunteer of Namibia Red Cross Society. So I was working with a community, in a community. Then when the advertisement came for the health extension worker, my community themselves, they called me to inform me about this. Then now I'm very glad to help my community because I'm from this village and I know them very well. I have been growing up here Then I know everything about the health, everything about culture, so I know how can I deal with them.
Twanja Mbinge believes that raising awareness and changing community attitudes lies at the heart of his work.
Our people, they are not taking like tablets or the pills they get from the hospital seriously. So they take it if they are not feeling pain, then they will not take it. If they are feeling pain, then they will take it. And they are not taking like the water we are drinking is not good, and because their parents, their grandfather and grandmother, they were drinking from there, so they thought it's okay for us. So but now we have to put more effort in indicating them that water is not good, and we have to do this and we have to do this. But we are trying, but they are changing bit by bit. So the other thing the community are experiencing is to take the children to the immunization. It's very, very challenging here. They don't know the importance of immunization. So because when they were growing up like that, they were not immunized or something like that. So now it's very hard to deal with them, but they are coming.
Immunization of children is very, very important at this stage, particularly in the more marginalized communities. We're seeing that just about 60 to 70% of children are actually immunized. Now, if we look at disease like measles, which is very infectious, we would like to see at least coverage of 90 to 95%. And what we've seen now in those households where the health extension workers have engaged already, they pick up the kids, they bring them to the clinics, they have them immunized there, and we're already seeing in terms of monitoring the impact that some of the vaccination coverage is picking up.
The Health Extension Workers Programme is an important initiative of the Namibian government aimed at bringing essential health services to all citizens, including those in isolated rural communities.
Every remote village or community should have some community health workers, without exception. Maybe the urban centers like the capital Windhoek, which is more integrated, there are a lot of clinics in the suburbs, etc. We can look at that at the last resort, but we want to devise our strategy of health service case delivery without inwards. So we're starting in the most remote part of the country and coming down to urban area and peri-urban areas.
Chief Goliath Rushana is the chief at Otuvemba village, where Twanja Mbinge works.
Oami Goliath Ruchani umurumendu
He recognizes the positive impact on the community he leads of having an extension worker in the village. For example, if Twanja sees that a child is unwell, he will tell the parent that she must go to the clinic. There is now also greater community awareness of the need for hygiene, and the water-saving tippy tap introduced through the Health Extension Programme is used for washing hands. Drinking water taken from the local spring is now also routinely purified. He hopes that the programme is expanded so that villages throughout the country can benefit.
This program must be countrywide because it's helping the people, because our people, they don't know the thing about in health. Sometimes, like here, our people, they are using their traditional way. Like when we are coming to the giving birth, some of them are just giving birth in the community. They don't know the importance of going to the hospital. So, but now the health extension program is encouraging them to go there and deliver at the hospital.
The daily routine for Namibia's health extension workers includes walking with their heavy packs to the homesteads of the community members in their villages and screening their clients following carefully developed protocols. Nguverota Shuma heeded the advice given to her and had her child in the hospital, where properly trained doctors and nurses were on hand. She encourages other women to do the same and not to risk giving birth in the village. She also feels that the Health Extension Workers Programme should be introduced throughout Namibia. Health extension workers are not qualified doctors or nurses, and they do not make diagnoses or give out medicines other than a general painkiller. Nevertheless, they are formally employed within the health system and receive salaries. In addition to health promotion, they take temperatures, weigh babies, and take arm measurements to ensure that mothers and babies are not suffering from malnourishment. They also check health passports and screen for warning signs of potentially serious illnesses, like persistent coughing or pain. Where their observations suggest that there might be a problem, they refer the client to the nearest clinic or hospital and check that the client does in fact make the trip. Walking from homestead to homestead can be an exhausting undertaking. Rural villages often consist of homesteads that are kilometers apart. Pomundu Kapi, for example, lives and works deep in northern Kunene region. For monitoring purposes, she refers to a map she has made showing the relative positions of all the homesteads she must visit. For her, walking from one end of the spread of homesteads to the other takes about 6 hours. Today she is screening a pregnant woman in Oshisa village, Ngwakwataroko Hepute. Before this pregnancy, she received no antenatal care and she gave birth at home without any medical support. Even though it will be difficult for her to make the journey, she has decided that this time she will go to the hospital to give birth. With funding provided by the European Union, the World Health Organization is supporting the ministry in conducting both training and field monitoring of health extension workers. The field monitoring ensures that they are in regular contact with the health system through monthly feedback meetings, that they are setting and meeting monthly targets, that they have all the supplies that they need, and that any problems they experience are being addressed.
We've got mobile outreach teams. Whenever those go out into communities and they have particular points, health points or visiting points, they engage with the health extension workers that are present there. They should give them support. If there's particular issues that they find difficulties with, they help them. They bring in additional expertise, maybe an environmental health practitioner, maybe a social worker. So that also helps to really make them more effective.
While health extension workers' time is mainly dedicated to screening individual clients, they also conduct individual and group health promotion sessions. Following concerted and coordinated national campaigns, real progress is being made in Namibia's fight against HIV. Health extension workers like Erica ensure that critical messages are heard, not only in regional centres, but also in rural homes, so that all Namibians, especially those most at risk of infection, are empowered to take necessary precautions.
I'm saving these people from Navlongwe. I'm a health extension worker here. I used to promote the health promotion about child health.
Erica devotes a significant amount of her time to health promotion, covering issues ranging from condom use, child health and antenatal care, to the dangers of alcohol and tobacco abuse, the advantages of male circumcision, how to avoid both communicable and non-communicable diseases, and the importance of immunization. Since its introduction in 2012, the Namibian Health Workers Program has already had a profound impact on the lives of the many thousands of Namibians living in isolated rural communities.
Health extension workers are the eyes and ears of the communities, linking communities with the health facilities, promoting health, preventing diseases, identifying injuries and illnesses for first aid and for timely referral to the clinics and hospitals, reporting unusual events and outbreaks of diseases for investigations and management. They're playing a significant role in achieving universal health coverage in Namibia. Healthcare providers are promoting health and survival for individuals, families, and communities. WHO is very proud to be part of this initiative, along with other UN agencies, Ministry of Health and Social Welfare, and European Union.
We appreciate the people who've been our backbone in this project. The World Health Organization has tremendously supported us right from the beginning up to now, and we look forward to more continuous collaboration and support from the WHO and other agencies, so we appreciate it.
The Health Extension Workers Programme is a major initiative being rolled out by the Namibian government, with support from development partners such as the World Health Organization and the European Union. Already, its impacts can be seen as it ushers in a new era in how people in remote areas access basic healthcare.
Wow.